So before we get started, I kind of just want to talk to you about your lifestyle. So I know you're a runner and you've been dealing with this pain for about 6 months. You mentioned that your symptoms tend to fluctuate depending on the stress and the workload, and that your back often feels stiff. But you also mentioned that you've been told your spine might be out of alignment and that bending forward makes you nervous. So those things are really important for me to understand because the belief and fear around movement can sometimes make the back feel more guarded and stiff. So I was told that you had an MRI, so that showed some disc degeneration around L4, L5. So I just want to reassure you that those kinds of changes are extremely common and many people have them without any pain at all and they never even know about them. So don't look at that image as something that means your back is damaged or fragile and makes you afraid to move. Instead, think about how we can help your system feel safe moving again, especially with activities like bending or running that matters most to you. So manual therapy can sometimes help with that by reducing the stiffness and improving comfort level and giving your nervous system a new movement experience. So when we think about your joints and movements, I'm not trying to identify one exact vertebrae that's out or slipped. Research shows that those kind of precise diagnoses aren't very reliable, so instead we want to just look at our all around and overall movement patterns. So for example, when you bend forward, you actually have full range of motion, but you move slowly and cautiously. So that tells me that your spine can move, but your body might be protecting the area a bit. And sometimes that protective muscle activation can create the feeling of stiffness. So the goal of a hands-on technique like this isn't to force something back into place or force your body to move in a way that doesn't want to, but instead it can help temporarily reduce the guarding and improve your comfort and make movement a little easier. When we look at what's happening in your back and we see how you're moving, we see a bit of mobility disconnect. So you can side bend perfectly fine, but you're very cautious with bending forwards or backwards. So this stiffness that you feel isn't necessarily a stuck joint. It's more likely a neuromuscular output. So your brain's way of bracing your spine to keep you safe because it's perceived as a threat. We notice that your hip rotation is a little bit limited on that right side. In runners, when the hips don't move fully, the back often has to pick up the slack, which can exhaust this thing called adaptive potential in your back. So our goal with manual therapy today is to provide comfort and a system reset. We aren't going to force anything. We're going to try to use touch to communicate with your nervous system that it is safe to let go of that muscle guarding. And that your body is safe to move and you are strong. So my role as your physical therapist is not looking for one perfect click to fix you. I'm looking for the right amount of pressure to help your body feel looser and more capable. I am trained to perform thrust joint manips, but I will only do so if we both feel it's the best and safest option for you today. So I'll be constantly checking in with you to see how you respond. You might even get annoyed by the amount of times that I do that. But we will adapt the pressure entirely based on your comfort level and your response. So please let me know as we go through this. If you ever feel uncomfortable, if you ever feel like something feels wrong or a lot of pain, just let me know and we can adapt appropriately. So our approach today, it's kind of built on three main pillars: safety, comfort, efficacy. So we are prioritizing safety by screening you thoroughly before we even begin. We're prioritizing comfort by ensuring every position we use feels good to you. And then finally, we're prioritizing efficacy by pairing this hands-on work with the exercises that you need to stay strong on the road. So this partnership that you and I have is at the center of every decision we make. So before we consider any high-speed techniques, we're going to perform a spinal torsion test so I can see how your spine handles rotational stress. So before we do anything, I'll have you lie on your stomach in a relaxed neutral position. From here, I'm going to work segmentally down your spine, starting around the thoracic area near T12, and gradually working towards your lumbar segment, so like your low back. My hand here is gently blocking the spinous process, which helps me control where the movement occurs. Then my other hand is contacting your pelvis near the opposite bony landmark. It's called the ASIS, but it's basically just the very front of your pelvis bone. And I'm lifting that or rotating that side of the pelvis upwards, so I'm kind of pulling up on it while maintaining the guarding on your back with the other hand. So what this does is it creates a controlled rotational force through the lumbar spine where the hand is blocking the spinous process, but it helps localize and control the movement. The reason we use this setup is mainly for force control and safety, but stabilizing one part of the spine and moving the pelvis can introduce a gentle rotational movement without putting excessive stress on your joints and bringing that muscle guarding back in. So this type of movement can sometimes help reduce the stiffness and give your nervous system new input that that movement is safe. And here's what I'm looking for to decide our next steps. A green light would be a minimal risk. So that'd be a firm, springy resistance that doesn't hurt, and we consider a thrust technique to help with the stiff feeling if that's the case. A yellow light is more of a precaution. So this is if this reproduces your familiar soreness, or if you feel the muscles pushing back against me, then we'll skip the thrust and we'll use a much gentler, more rhythmic movement instead. A red light is an absolute contraindication, means we definitely won't be doing it. So that's if I feel any clunking or unusual looseness in the spine. And if it causes any numbness or tingling, then a thrust is strictly off the table. In that case, we would focus entirely on stabilization and coordination to give your back the support that it needs. So just explaining a little bit as to why this technique works. So one important thing I want you to know is that we're not trying to put bones back together or back into place. Instead, manual therapy works kind of like through a few different mechanisms. So the first mechanism can temporarily reduce the muscle guarding or protective tension, which can make the back feel less stiff. Secondly, the touch and movement can provide a sensory input to your nervous system and can help reduce any pain and sensitivity in the area from that too. And third, it can help people feel more comfortable and confident in moving their spine again. So the goal is really just to support your movement and comfort and not mechanically correct the spine. So as a therapist, I have to think about my own role in this process. So I need to stay within my training and my scope of practice and make sure that any techniques that I use is something that I'm comfortable and competent in completing as well. So I pay close attention to how your body responds during the technique. So if something increases pain or doesn't feel comfortable, I would modify the approach or the steps. And stop. And communication is really important here because I want you to feel comfortable and tell me what you're feeling so that we can both adjust together so that we have a nice cohesive environment. My overall approach follows a framework that focuses on a few ideas. So first is safety, which means we're screened for serious illnesses and serious issues and making sure that our technique is appropriate for you. Secondly is comfort. So I try to position you in a way that feels relaxed and adjust the force based on your feedback, hence the pillow and the asking for your consent and seeing if, monitoring if anything hurts or changes as we do different techniques. Third is efficacy. So meaning manual therapy is just one part of the treatment. So we would also combine this with movements like exercise and education. But communication is also key. So I want to explain what we're doing and make sure that it makes sense to you as well. And then finally, we want everything to be patient-centered or person-centered, meaning that our plan focuses on helping you return to activities that you like to do, like running or bending over and picking things up correctly and being comfortable doing those things. So before we're using higher velocity techniques like thrust manipulations, we also perform biomechanical testing or just like different types of testing that look at how your spine tolerates movement and loading. And moves comfortably and symptoms aren't reproduced. The tissue feels stable. That suggests that it's minimal risk and the manipulation may be considered. But if the movement produces discomfort or guarding or mild symptoms reproduce, that would be more of a precaution, and we would likely use like a gentler mobilization technique instead of like a thrust manip. And so if the test reproduced severe pain, neurologic symptoms, suggested structural compromise like a fracture or something like that, that would be an absolute contraindication, meaning like we would not perform that manipulation at all. So the goal of these tests is to make sure that we're always prioritizing your safety. So overall, the goal of this approach is to help you feel more like yourself again, help your back feel more comfortable and reduce the stiffness and gradually build your confidence in movement again. So manual therapy can be a helpful tool, but it's always combined with movement and active strategies to help you get the activities that you enjoy doing better.